Hello friends, today I will talk about epilepsy or fits. So epilepsy unfortunately is quite common in our country and it is seen in most places. In epilepsy people have what is called as fits or convulsions, and the commonest we see is involuntary jerky movements of the hands or legs and the person loses consciousness. But there are various other symptoms of epilepsy also, and broadly they are classified into two types: focal or partial, where only a part of the body gets affected and the person is conscious, and then generalized type of seizures where the person loses consciousness. So the symptoms can be varied, like as I mentioned, commonest thing will be jerky movements of the hands and legs, but sometimes they can be very subtle, like just staring spells, or sometimes automatisms or lip smacking movements, like something like that. So symptoms can be variable, but whenever symptoms are abnormal and you suspect that it could be epilepsy, you should consult a doctor, because with proper history taking, and if you can record an event on your mobile video and show to the doctor, that also will help in the diagnosis. And then there are specialized tests like brain scanning, such as CT scan, MRI and EEG. So with the help of these, the doctor will be able to make a diagnosis. Now once the diagnosis is made, how is it treated? So the treatment can be, the first is anti-seizure medications. So they are given on a daily basis for a long term to prevent the subsequent fits, convulsions or seizures. And sometimes epilepsy can be secondary, means there can be a disease in the brain, it can be infection, or it can be tumor or any other pathology. So that primary cause also needs to be treated. And these anti-seizure medications are usually required for a long time, and your doctor will be able to guide you for how long you have to take. But it is important to be regular, because these medications, even if they are skipped one dose or few doses, there could be recurrence of seizures. And as if somebody has a seizure and falls or becomes unconscious, there is a risk of injury. So that brings us to what precautions should be taken by people with epilepsy. So they should avoid driving, because during driving, if the seizure occurs, it can result in injuries. And same thing is during swimming also. There is a risk of seizure occurring during swimming, and then the risk of drowning. So these are the important precautions to be taken. And what are the things a person can do to reduce the risk of seizure recurrence? So in that, number one is obviously they have to take their medications as prescribed by the doctor on a regular basis, because poor compliance or skipping medication is the commonest cause of seizure recurrence. Second is proper sleep, because lack of sleep can also trigger seizures. Then too much of stress can also trigger seizure attacks, and very high fever. So if somebody has high fever, it can result in seizure, especially in children between the age of 6 months to 6 years. So the fever should be lowered down by using antipyretics such as paracetamol and cold tepid sponging. So if temperature is lowered, then the risk of seizures is less. So with all these measures, a person with epilepsy can lead a normal life. Of course, we know that many people with epilepsy, they go on to do many professions, and they are involved in many jobs, just like any other person. So my main message is that epilepsy can be easily diagnosed, can be easily treated, and people with epilepsy can lead a normal life.